Thank you so much, Chairwoman Maloney, for this important hearing and for our committee staff for all their hard work. Mr. Schultz, I'm sure serving as the CEO, you may have little to no contact with how your actions hurt real people, like my residents in 13 District Strong. Your actions have consequences, as you have heard from many of my colleagues. It has hurt people like Miss Lisa McRipley, who lives with MS in my district. Lisa pays $6,000 per month for her MS medication and about an additional $1,000 just to treat her symptoms of pain, fatigue, and balance. Now, Mr. Schultz, I know $7,000 per month may not seem like a much to you as the CEO of Tlaib Pharmaceuticals, but Lisa doesn't have $7,000 of disposable income per month. The vast majority of Americans don't. I understand that Copaxone, the drug used for MS, was first introduced on the market in 1997, and the wholesale acquisition at that time was only $8,000 annually. Today, it is $70,000. So, Mr. Schultz, yes or no, do you believe it is reasonable for Lisa in my district and others like her to pay nearly $70,000 a year to access Copaxone?
No, I would not think that would be reasonable at all. But
thank you. I just asked for a yes or no. It's not reasonable, so let's talk about other items that your company does. So I also know that the drug companies frequently mislead the public by claiming charitable programs help ensure that patients who need medications can get them. But those programs do not cover everyone, and they are not reliable for patients, and they actually drive up the cost for many of my residents. In fact, I actually asked Lisa, who is on Social Security, if she was able to access such charitable relief, and she had no luck. Documents obtained by this committee, Mr. Schultz, suggest that these programs actually serve drug companies' own financial interest. Mr. Schultz, does your company donate to third-party independent charities which covers Medicare beneficiaries' out-of-pocket costs for Copaxone?
We do contribute to charities that have the purpose to secure access.
Great. So, Mr. Schultz, yes or no, would you consider donations to these foundations to be financial investments?
No, I would not. I would consider it to be help.
Well, let me tell you why you're misleading us right now. Internal documents provided to the committee show that Teva company did view these programs as financial investments, even described them that way. In your own 2008 Copaxone work plan, which is Exhibit 37 in your materials, estimated that the company would lose over $11 million in sales if it reduced its, quote, investment in Medicare Part D grants by $44.3 million, as you can see here. The work plan also estimated that Copaxone net sales would decline by $45 million in 2011 if your company were to, quote, eliminate Medicare PAP investment. So, Mr. Schultz, it seems that Teva company expected Copaxone sales to decline if it decreased donations through these grants. Is that correct?
This is more than 10 years before I joined the company, and
it's pretty clear. It's pretty clear, Mr. Schultz. In my district, Mr. Schultz, we call this a side hustle. Your pharmaceutical company makes these so-called charitable donations so you look like you give a shit about sick people. But in reality, these are just another scheme by your corporation to make money off of sick people. Mr. Schultz, Lisa needs her medication to live. She's not part of a hustle and should not be one. Let's turn to Teva's program to cover the co-pays of Copaxone patients with commercial insurance. Again, this is how you're misleading the public. According to Teva's own internal analysis, the company spent $54.6 million on commercial copay program in 2014. But in return, you all got $257 million back. That's 371% profit, Mr. Schultz. Mr. Schultz, these are companies' own estimates. This is your own documents. And they suggest that what you and other corporate executives claim to be charitable-type programs are actually profit-motivated efforts to retain patients and generate sales. I want to close off with Lisa's words, and this is so important because rarely do we put a human face behind so much of the actions by these corporations. Lisa said, quote, "We need this medication to have a decent life. There is no cure right now to MS. So we need this because we want to continue to contribute to society. We want to make an impact." So, Mr. Schultz, you need to go back and actually stop misleading the public and making sure that these drugs, again, have people's quality of life at jeopardy, their right to live at jeopardy, I ask all of you and for my colleagues to please pay attention to many of these documents again submitted to the record. Thank you so much. I yield.